and hi everyone. My name is SHAFINA. We'll start the presentation with introduction of vector-borne zoonotic disease. It's a pleasure to welcome you to this presentation on vector-borne zoonotic disease, an interesting and important subject in the field of public health. We shall start the presentation today to comprehend this disease, their relevance and effect they have on both human and animal population. A particular group of infectious diseases known as vector-borne zoonotic disease are those transmitted from animal to human through the bites of insects known as vectors, such as fleas, ticks, and mosquitoes. These circumstances involve a wide range of pathogens including bacteria, viruses, and parasites, which can cause a number of diseases in both human and animals. These diseases have a complex and fascinating transmission cycle. It involves a complex interaction between human and serve as unintentional host, an animal who serve as reservoir, host, and infection carriers known as vector. By consuming infected animals, the vector pick up the pathogen which they can pass on to human during subsequent blood meals, potentially causing outbreak and the spread of the disease. The public's health is significantly impacted by this disease. They have the potential to cause fatalities and severe harm to millions of people globally. The prevalence of these diseases is frequently higher in areas with poor sanitation, limited access to healthcare, and insufficient vector control methods. Additionally, zoonotic infections spread by vectors can result in long-term issues and disabilities, creating problems for affected people and communities in the terms of economy, society, and healthcare. It is essential to comprehend vector-borne zoonotic disease from a One Health perspective. The idea of One Health acknowledges how intertwined environmental health, animal health, and human health are. It recognizes that there are close connections between the well-being of people, animals, and ecosystems that tackling this problem call for interdisciplinary cooperation. Together, medical experts, veterinary professionals, ecologists, and legislators may more successfully address the difficult problem brought on by these diseases. In our investigation today, we will examine the nature and behavior of vector-borne zoonotic disease, as well as their effect on public health. In this section, we will look at few well-known vector-borne diseases in detail, including their implication for the general public health, One Health perspective, prevention measure, and control method for lessening their effect. Our ultimate objective is to highlight the significance of understanding and addressing vector-borne zoonotic diseases. We can work towards a future where the burden of the diseases is reduced and the health and welfare of both human and animal are protected by increasing awareness, encouraging interdisciplinary collaboration, and putting effective preventative and control measures into place. Let us begin our presentation on vector-borne zoonotic diseases.
Thank you, Shafina, for the great introduction earlier. Now, we are going to explore our topic, vector-borne diseases, with me, ASMAH, as your host. Vector-borne diseases are illnesses caused by tiny organisms like parasites, viruses, and bacteria. These organisms are transmitted to humans by living creatures called vectors. Vectors are usually insects that suck blood like mosquitoes, ticks, and fleas. When a vector bites an infected person or animal, it injures the disease-causing organism. Later, when the vector bites another person or animal, it can transmit the pathogens and make them sick. Often, once a vector becomes infectious, they are capable of transmitting the pathogen for the rest of their life during each subsequent bite or blood meal. Every year, more than 700,000 people die from vector-borne diseases like malaria, dengue, Chagas disease, yellow fever, and Japanese encephalitis. These diseases are most common in tropical and subtropical countries and often affect the poorest populations. Outbreaks of these diseases have occurred in recent years and have caused a lot of suffering and overwhelmed healthcare systems. First, let's talk about malaria. Malaria is a disease transmitted by mosquitoes and is most common in sub-Saharan Africa and South Asia. It can cause fever, chills, and flu-like symptoms. If not treated, it can lead to severe complications and death. In 2020, there were around 241 million malaria cases worldwide and 327,000 people died from it, mostly children in sub-Saharan Africa. Next, Chagas disease, also known as American trypanosomiasis, is a potentially life-threatening illness caused by a parasite. It is mainly found in Latin American countries. The disease is transmitted to humans and other mammals through contact with the feces or urine of triatomine bugs, also known as kissing bugs. The first signs of Chagas disease can be a skin lesion or swelling of the eyelids. Yellow fever is also an infectious disease transmitted by mosquitoes that primarily bite during the day. It is endemic in 34 countries in Africa and 30 countries in Central and South America. Common symptoms include fever, muscle pain, headache, loss of appetite, nausea, and vomiting. Next, we have Japanese encephalitis, which is a viral infection spread by mosquitoes. It belongs to the same family of viruses as dengue and yellow fever. Japanese encephalitis is the leading cause of viral encephalitis in many Asian countries, with thousands of cases reported each year. Symptoms are usually mild and include fever and headache. Other diseases like chikungunya, leishmaniasis, and lymphatic filariasis cause long-term suffering, disability, and occasional stigmatization. However, in Malaysia, a tropical country, vector-borne diseases are a significant concern. Dengue fever is a year-round threat, with the highest transmission occurring between October and March. In 2022, Malaysia reported around 64,078 cases of dengue fever, and it has been a constant threat in recent years. Lymphatic filariasis, also known as elephantiasis, is another vector-borne disease in Malaysia. It is caused by worms transmitted by mosquitoes. According to My Health website, elephantiasis has been spotted as endemic in 8 states such as Kedah, Perak, Johor, Pahang, Terengganu, Kelantan, Sabah, and Sarawak, and can cause swelling in the limbs and other complications. Vector-borne diseases have always been the least worried, since people would claim it as an insect bite only and brush it off. It is essential not to underestimate the threat of vector-borne diseases. They can be severe and even fatal if not treated promptly. Prevention and control measures are crucial in fighting these diseases, but I will stop here and let my teammates DAMIA further explain it. Thank you.
Hello, my name is ALIANI binti ROSNI and my matrix numbers is 065859. First and foremost, I would like to thank the previous speaker, SITI or ASMAH, for the explanations of additional information concerning vector-borne disease just now. Now, I will go over on how to prevent and control this vector-borne zoonotic disease. Infected arthropods species such as mosquitoes and ticks transmit vector-borne disease to humans by animals by biting. Various of conditions can lead to spreads of vector-borne disease, and predicting where and when this outbreak will occur can be challenging. The best prevention is educating individuals on what public health efforts can be practiced to reduce vector populations in their community. According to the study, the number of recorded cases of vector-borne disease conveyed by mosquito, ticks, and fleas more than doubled between 2004 and 2018. This demonstrates that vector-borne diseases are spreading at a faster rate on each year. As a result, we must work to stop this spreading of this vector, and in the same time, we can also reducing the disease transmissions. So first of all, let me share about the prevention of the most vector, which is mosquito. A mosquito viral infections such as dengue, filariasis, malaria, Japanese encephalitis, and chikungunya is currently the world's fastest spreading vectors-borne disease. The dengue mosquitoes lays its eggs on the walls of water-filtered containers, and adult mosquito often rest in duct area like under the beds or behind the curtains. Thus, there are several actions to reduce mosquito breedings. Firstly, reduce the mosquito breeding sites by clearing out trash from yards and emptying vessels of water, including tires, discarded drums, uncovered water storage containers, blocked gutters, and upturned coconut shells. Next, clean and empty the water containers once per week, or where this cannot be emptied, contact the local health authority for putting some safe chemicals like abate into the water. Always wear clothing that minimize skin exposure during daylight hours when mosquitoes are most active, especially dengue mosquito, which are more actively when during dawn and dusk. If there is an air exposure scheme, don't forget to apply repellents to the area. When mosquito bite indoors, biting activity can be reduced by using household pesticide spray products, mosquito coils, or other insect vaporizers. Lastly, to avoid night biting mosquitoes that can spread lymphatic filariasis, we can possible to strengthen house protection with mosquito proof wire mesh or sleep under mosquito nets. Other than mosquitoes, ticks are also one of the common vectors that spread the disease to humans. Ticks basically live on the grounds or climb 20 to 70 cm on the bushes or grasses. They find hosts with the help of the temperatures and movement of host body. The initial bites of ticks is typically painless, and it is difficult to detect any movement on the skin. The risk of tick-borne disease can be reduced by avoiding tick bites and removing ticks from your body. It is difficult for us to eliminate and minimize tick breedings, since ticks may live almost anywhere and can stay in one area for a lengthy period of time without a host. Preventing a tick from biting our body is not a hard thing to do. We can do this by using insect repellents on any exposure skins when we go to the bushes area. Next, wear protective clothing with long sleeve and long trousers. Tuck into socks or boots, and also treat the socks and trousers legs with permethrin containing insecticide. This will make the ticks more difficult to get into our bodies. If ticks are already on your skin or body, remove the ticks from your body immediately. For your information, ticks prefer the soft skins and hairy areas. Remember to always inspect the entire body for ticks after outdoor activities. To remove the ticks, it can be done by pulling them out immediately by using tweezer or any specially designed ticks remover. Or if there are no appropriate tools to use, we can easily use our finger to pick them out.
Thank you so much, Damia, for the explanation on solution, prevention, and control of vector-borne disease. Hi everyone, my name is NURUL and NASUHA binti Muhammad Ali, and you can call me Ain. My metric number is 066123. We already know about the introduction of vector-borne disease. We already know what is the disease because of vector-borne, and then we already know who is the vector. But right now, have you ever wondered about the impact of public health that happened because of the vector-borne disease? Alright, come. During my research, I did found a few pros and cons on public health. The vector-borne disease is the disease that give outbreak to human and have taken more than 700,000 deaths every year. The distribution of vector-borne disease is determined by a complex set of demographic, environmental, and social factors. The burden of this disease is highest in tropical and subtropical areas, and they disproportionately affect the poorest population. As we all know, VBD is the disease that carried by vector. Climate is one of the factors that influence the distribution of disease borne by vector, such as fleas, tick, and mosquito, which they will spread the pathogen that cause of illness. Referring to the picture of map, in 1996, the population of vector differ than the population from 2018. It's getting bigger and bigger and attack the public health of humans. Because of that, the symptoms from this disease can be very and included headache, pain, fatigue, dengue, hemorrhage fever, and encephalitis, and nausea. The impact on health effect from vector-borne disease, including their extent and frequency, that will be vary as the climate change. The good impact of VBD are opening the opportunities for public health improvement. As an explanation, the vector is control critical component in preventing and responding to vector-borne illness epidemic. Some options include reducing greenhouse gas emission and preventing forest and wetland to decrease climate variability and contain vector habitats. Furthermore, enhancing surveillance system and deploying every warning system might reduce vector exposure and susceptibility to vector-borne disease in vulnerable population.
Thank you to the previous presenter. Now we will discuss this topic in one health perspective. As we know that the vector-borne diseases mentioned before are diseases that causes by vectors such as mosquitoes, rats, cockroaches, bats, and so on. If we look at all these vectors at a glance, we will find that these vectors are pests that are really disliked by humans because of the hygiene problems that they do, such as contaminating food and the environment, as well as their own conditions that are disgusting to humans in terms of their bad appearance or their bad behavior, disgusting and dirty. They are naturally found in dirty and abandoned areas without being properly managed, including inside the buildings or human-occupied dwellings. Even if we look at the big cities in our country or abroad, the existence of a large population of these pests have become a big problem for the management of municipality there. The existence of places where pests such as sewer systems, in addition to the wrong waste management system, such as not throwing garbage in the places that have been proper, has caused the existence of these problems in the big cities. This issue not only plagues life in the city, but the people in the countryside also not exempt from this problem. Rural areas usually rarely have an efficient waste management system, which causes waste to be dumped everywhere. What is more sad is the attitude of the general public, who do not care much about this matter, which wasn't the situation, where they prefer to throw garbage everywhere or dispose of it in the wrong way, such as burning it instead of throwing it in the place which has been provided by the authorities. It is causing the environment to become very, very dirty, so that it allows this pest to live and reproduce, and further lead to an increase in vector-borne diseases, and will ultimately bring bad effect to the public itself. If we look at the chronology of the transmission of any vector-borne diseases to humans, we will find that three factors, such as human, animals, and the ecosystem, are interrelated in the existence of vector-borne diseases. For example, we take kencing tikus disease. during visit to the waterfall, some visitors throw garbage over everywhere in the waterfall area during their visit, which caused the environment of the waterfall become dirty, very dirty. This dirty area will attract rats that are vectors for this disease virus to live there. In addition of they live there, they also will contaminate the water there. As a result, visitors who bathe in the contaminated waterfall after that will be infected by the disease. Not only that, this zoonotic disease also can result to an outbreak. Therefore, the concept of One Health is introduced to the public to educate them about the importance for taking care of these three factors to maintain universal health and prevent any disaster involving public health, such as a pandemic, from occurring. This concept also emphasizes to the public to not only maintain their cleanness and their own health, even to maintain the cleanness and sustainability of ecosystem and prevent the breeding of pests that carry diseases. The concept of One Health focuses on an integration and unification approach in balancing and optimizing the health of humans, animals, and the ecosystem, which requires various collaborative efforts from various parties to achieve this objective. Now, this session will be continued by the next presenter. Thank you.
So, with that, we have reached the end of our presentation today regarding vector-borne zoonotic disease. As we come to the end of our discussion on vector-borne zoonotic disease, it is clear that this condition provides serious problem for international public health. We must give this complex transmission cycle our whole attention and effort because of the complex relationship that exists between animal vectors and humans. We have seen the effect of numerous diseases throughout our discussion, including Zika virus, chikungunya, dengue fever, and malaria. These diseases strain healthcare system, economies, and communities in addition to cause misery and death. Nevertheless, despite these difficulties, we also have seen the outstanding effort made by researchers, medical experts, and public health organizations around the world. It is very encouraging to see how committed they are to comprehending the ecological background, monitoring transmission trend, and creating potent prevention and control measures. In order to combat zoonotic disease transmitted by vector, prevention is essential. A key factor in lowering the risk of transmission is integrated vector management, which involves action including vector control, environmental management, and community engagement. The creation and implementation of diagnosis tools, vaccination, and efficient treatment choice are equally crucial. The fight against these diseases can be won with the help of education awareness campaigns. We may encourage a proactive approach to help and lessen the burden of vector-borne zoonotic diseases by educating people and communities on preventive measures, symptoms, and early detection. At the local, national, and international level, cooperation and coordination are also crucial. We can expand research efforts, promote innovation, and improve surveillance efforts for this disease. By pooling data, resources, and knowledge, the landscape of vector-borne zoonotic disease is continuing to be shaped by globalization, urbanization, and climate change. A multidisciplinary strategy that incorporates environmental, social, and health prevention is needed to respond to this concern. We can endeavor to create resilient and healthier communities by addressing the root causes lead to the spread of these diseases. In conclusion, diseases that are spread by vector are major global problems. They draw attention to how linked ecosystem, animals, vector, and people are. We have the ability to change things by working together. We can lessen the effect of the diseases and work towards a better and safer future by fostering research, increasing awareness, and putting into practice efficient preventative and control techniques. We appreciate the enthusiasm and dedication to comprehending and addressing the problem brought on by vector-borne zoonotic diseases. Let's continue to work together to create a future in which the threat posed by these diseases is greatly diminished and the health and welfare of human beings and animals are protected. That's all from us. Thank you.